Hey guys, it's Tina Sheth from Rebalance Physical Therapy, and today we are going to talk about shoulder pain. I have had some patients come in that have been complaining about their shoulders bothering them from doing all sorts of activities this summer, from like gardening to swimming to lifting boxes. And many of them are afraid that they've torn their shoulder. And so I wanted to talk to you today about how can you tell whether you have done something to your shoulder to the point where you've torn it, okay? And so there's kind of three categories that I'm going to go through. You can have a tendonitis, which is very common from doing repetitive activities, throughout your day, okay? Then you can have a partial tear, which is you've actually torn some part of the muscle. And then you can have a full tear. And a full tear is where you've torn it to the point where the muscle and tendon has actually stripped off of the bone, okay? So how can you tell which one you have? With a tendonitis, okay, what you'll typically feel is you'll feel pain, somewhere around the shoulder. It could radiate down into the arm, okay? Same thing with a partial tear, okay? And with a full tear, that's typically what you'll feel. But with a tendonitis, what you will feel is more pain than you will feel any weakness when you go to elevate your shoulder, okay? It's going to be more painful, and it could be pain at rest, it could be pain when you lift it, but it's more pain than weakness or heaviness of the shoulder. Now, with a partial tear, you're going to have a combination of the two. It can be just as painful as a tendonitis, okay? But you'll also find that there's some weakness or heaviness when you go to elevate the shoulder, okay? And with a full tear, you're going to find that it feels more heavy and weak than it does painful. And the other thing that you might experience with a full tear is that when you do go to elevate or lift the shoulder, that you'll also feel like you have to kind of hike your shoulder like this in order for you to lift the arm, okay? So that's how you can kind of tell whether there's a tear going on. Now, what do you do about it? The easiest thing you can do is give us a call. We can actually see patients, without seeing a physician first to be able to tell whether you've done something to your shoulder. Or not even you, but maybe your son or your daughter has done something and you're not really sure what's going on. Give us a call. We'll get them in. And we'll take a look and see what specifically is going on. Because chances are they might just have a tendonitis going on, and we can start treating them and getting to the heart of the issue right away. In addition, we might feel that they also do need to go out and see either a sports medicine doctor or an orthopedist or a physiatrist. And we might say, hey, while we're starting the rehab right away, also we want you to go see one of our trusted healthcare practitioners that we work with, one of our orthopedists or sports medicine or physiatrists, okay? And same thing with a partial tear and a full tear. But we'll be able to diagnose it and evaluate it right away and then be able to start treatment right away rather than waiting another 1 or 2 weeks before you get in to see your doctor and then they decide, okay, we need to go get some imaging and maybe then you need to start rehab. Because it really is critical that you start treating, especially if it's a tendonitis or even a partial tear, start treating it right away. Why would you even wait? There's no downside to start treating certain things if it's evaluated correctly. There's no downside to start treatment right away. So I hope that helps. It gives you a little bit of guidance into if you are having some shoulder pain or you start experiencing some shoulder issues the latter part of the summer or into the fall. And I will see you on our next video. Okay, take care, guys. Bye.